to cover what exactly is first aid. First aid is a term used to describe providing someone with immediate and simple medical care in the case that they have fallen ill or experienced injury in an emergency situation. This is often done in hopes to stabilize the person enough that they can recover on their own, or until medical professionals can arrive to take them to receive professional medical care. This can apply to various types of injuries such as insect bites, bee stings, cuts, and burns. I will now be talking about the 4 steps to take in an emergency situation. The first step is to make an assessment of the situation. The second step is to ensure safety. The third step is to provide medical care. And the fourth step is to get help. Starting with the first step, assessing the situation. It is important to know the condition that your patient is in, whether they are currently conscious, breathing, or in a panic. It's also important to know what bystanders around you are doing and whether there are any clear and present dangers to you. It's also important to know what materials you will need to assist the patient in need. The second step, ensuring safety. You must always prioritize the safety of yourself before anyone else, especially when you are attempting to provide medical care. If you can ensure your own safety, it's then important to ensure the safety of the injured person. For example, bringing them out of harm's way or ensuring that the area is clear from any present dangers. It's also important to ensure that bystanders around you, especially those that are assisting you, are also away from danger. Third step is of course to provide medical care. After ensuring the safety of your patient and what materials you may need, it is then advisable for you to provide medical care. It is always important to know that as the person providing medical care, it is not advisable to ask the person injured what they would like to do. Instead, it is important for you to present options to them for them to pick in a situation, as they might not always know what is the best option, unlike you. And it's also important to ensure that you only do what is within your capabilities. The fourth step is of course to get help. If you are unable to stabilize the patient on your own, it's important to get help from those around you to get materials to assist the patient, or to assist you in holding the patient down or holding an appendage that you might be wanting to treat, or even to call professional emergency services.
Nosebleeds are common, and if you experience one, first sit upright and lean forward. By remaining upright, you reduce the blood pressure in the veins of your nose. This will discourage further bleeding. Sitting forward will help you avoid swallowing blood, which can irritate your stomach. Secondly, pinch your nose. Use your thumb and index finger to pinch your nostrils shut and breathe through your mouth. Continue to hold the pressure for 10 to 15 minutes. Pinching will send pressure to the bleeding point on the nasal septum and often stops the flow of the blood. If the bleeding continues after 10 to 15 minutes, repeat holding the pressure for another 10 to 15 minutes. And if the bleeding is still continuing, immediately seek for emergency care. If you experience bleeding cut or wound, first stop the bleeding. Apply direct pressure on the cut or wound with clean cloth, tissue, or piece of gauze until the bleeding stops. If blood soaks through the material, do not remove it. Instead, put more cloth or tissue on top of it and continue applying pressure. If the cut or wound happen to be on your arm or leg, raise limb above your heart if possible to help slowing down the bleeding. Secondly, you need to clean the cut or wound. Gently clean the cut or wound with soap and warm water. Try to rinse soap out of the wound to prevent irritation. Do not use hydrogen peroxide or iodine, as it can cause tissue damage. Thirdly, protect the cut or wound. Apply antibiotic cream to reduce the risk of infection and cover it with sterile bandage. If your bleeding do not stop after 10 minutes of applying pressure, or if you have severe bleeding, immediately call the emergency number 999 and seek for the doctors.
The top priority for nosebleed is to control the bleeding, and of course to keep the airway open for them to breathe and not to choke them with the blood. Okay, so there will be several steps to follow to help the patient get rid of the nosebleed. Okay, so the first important steps is you have to keep the nose level or the head level of the patients higher than the heart level. So that's then there will be no more pressure at the head. So better to let them sit rather than let them lie on the ground or on the flat surface. Okay, so first step, sit. Okay, and then the second step, let them slightly lean forward when they sit on the chair. So lean forward, let the blood drain from their nose instead of draining into their airways so that they won't be blocked. And then the patient or anyone near him can help the patient to pinch the nose using their fingers to keep on the pressure at the bleeding spot. And keep on the pressure for 10 minutes. After 10 minutes, they will go to step 3. After 10 minutes of keep on the pressure, release the pressure off, and you observe if the bleeding keeps on continuing, you can put on the pressure again for another 10 minutes. And you can repeat this 3 times, which is gonna be 30 minutes bleeding. Or 30 minutes of pressure on the nose. If the bleeding won't stop until 30 minutes of the bleeds of the pressure on, then it's a time for you to seek better emergency like the ambulance. But if the bleed stop within 30 minutes, then it's okay, which means the blood is already clotting your nose. And during the pressure, during the time when you keep the pressure on your nose, you can wipe the blood from your face or the one that dripped off from your face with anything like handkerchief or some tissues and stuff. And also try not to swallow the blood because the blood can irritate your stomach.
Okay, hey guys, now I'll be demonstrating on how to deal with a wound or cut using first aid items. First of all, I will be using red full coloring demonstrate to represent a wound or blood on my hand. Now you can see actually looks like I have a cut. So now I'll be treating this wound. So if you have a wound or cut and you're bleeding out of your hand or your legs, try to bring the wound above your heart to slow down bleeding, to actually slow down bleeding. So the next step, what you need to do is take a piece of clean cloth or tissue or gauze or anything you have available and cover up the wound, like so. And apply pressure to stop the bleeding. What you need to do next is, let's say if you're bleeding out of the tissue like this, as you can see, do not remove the tissue and replace it with a new one, but instead take another piece of tissue or wipes and add up. And if you still bleed above that, add another one and keep on adding and apply pressure on the wound continuously. Do not remove this because adding more will actually help reducing the blood flow.
The next step is to wash the wound. So first of all, you come to any place with clean water, and you wash your wound, like so. Then what you have to do is take any soap, clean soap, and to apply around the wound to clear off any dirt or anything which may cause infection later on, and wash your wound.
So after you wash the wound, what you need to do is take another clean piece of tissue and wipe it dry around your wound, and make sure it's completely dry and there's no soap left or even water. After you've done that, what you need to do is the final product. Before the final product is to apply antiseptic cream. This is optional, but I do recommend doing this because it reduces any irritation, future irritation or any sort. Just apply a bit and wipe around the wound. Make sure your hand is clean. Like that. As you see, that's the cut, and I'm applying the cream around it. And for the last step is what you need to do is take another piece of gauze or cotton to patch up. For patching up, first of all, you take a piece of gauze and make sure you fold it according to how much you need and take how much you need, and to cover up the wound like that. Just cover it up and use plasters to patch the wound like that. And make sure you can, I'm only using a bit for the demonstration, and you make sure you use it to actually stick it on there. If the cut is not serious, you can also use band-aids to cover up the wound, but follow the same process. So that's all for normal cut. But if you have, and after doing this, if you're still bleeding for more than 10 minutes, make sure to contact professional help or call 999, the emergency service, and go see a doctor. That is all.
We hope that you have enjoyed the video, and we'll see you next time.